Welcome back. Well, you know, summer will be here before we know it, bringing with it that summer heat.
Joining us today to talk about how the heat can impact your health is Laura Gamino with the Oklahoma Children's Hospital. Thanks for joining us.
Thank you so much for having me.
And thank you for bringing this guy right here.
Yes.
We're talking about summertime heat. It's right around the corner, and there's some shocking numbers. In 2021, Oklahoma had 46 heat-related deaths. It's very serious. What do you want folks to know about the heat and our bodies?
That was nationwide.
Nationwide, okay.
Nationwide, yeah. Well, the first thing we learned in pediatrics is that children are not small adults. And their temperature regulation, they heat up 3 to 5 times faster than adults. And so they just can't adjust like we can. And when you see them hot, flushed, they may be more irritable or confused even, or anything, and then they start having hallucinations and seizures as they get hotter. And hopefully that never happens.
Right.
But yeah, that's what helped.
You brought a friend with you this morning. What can we learn from Clifford?
Well, one of the tips that we give people is to, when we take our baby out from the back seat, is to put something in the front seat to remind us, whether it's Clifford, whether it's our work lanyard, whether it's our cell phone. And that doesn't mean that we love anything more than our babies.
Sure.
That's not what it is. It's just our brain goes on automatic. That's what research shows us. And so, you know, we get to work, we probably don't even remember the drive. You know, we're thinking about what the next step is and the next step. This usually happens also, children left in a car, is when there's a change in routine. Like if one caregiver usually takes a child to child care and then the other one does it because of some reason, it's usually a change in routine.
Because they're on autopilot doing what they normally do. They forgot about the one thing that's new in the routine that day. What about the difference between heat exhaustion, heat stroke? What's some good information for our viewers?
When our body temperature is 101, that's heat stroke.
Okay.
But at 107, when our body temperature is 107, is when the organs start to shut down, and you know that's when death comes. So and the car heats up so quickly because just in the first 10 minutes, the car heats up 20 degrees hotter than the outside temperature. And also, Oklahoma, you know, the temperatures get so hot, but children have died when it's as cool as 57 degrees outside.
Oh my goodness.
Yes.
Because it's just like an oven, basically. It
does.
The heat
just,
okay.
Yes.
And we know that we saw a jump recently in these number of incidents. Is there anything specific that's kind of contributing to this jump?
Well, it was highest right before the pandemic, 53 deaths nationwide, but then during the pandemic it did come down and into the 20s, but still, 1 death is too many. We've had 3 this year already.
Goodness.
Wow.
Yes, 2 in Florida, and
Wow.
I think the other one was in Alabama.
Okay. One more message for our viewers. What would you want to leave us with today?
If you see a child who is left in a car, we are a Good Samaritan state, and so we just need to get them out, call 911. It doesn't matter if we break a window. This is life and death.
Let the authorities sort it out later, but save the child first. Okay. Laura Gamino with the OU Children's Health, thank you so much. We appreciate it.
Thank you for having me.
Absolutely.